Prostate cancer is the most common cancer in men and the second leading cause of cancer death in men. Here's what you should know. So there's multiple risk factors for prostate cancer. These typically include advancing age, race, with African American men being at higher risk for prostate cancer and also more aggressive prostate cancer, and then family history. So we know that those men who have a first-degree relative, a father, brother, or uncle, are certainly at an increased risk, and those men who have multiple family members are going to be at even higher risk. Although there's typically no way to prevent prostate cancer, the most important thing is for men to become educated and well-informed about prostate cancer, and there are certainly many resources they can use to become informed. Certainly talking with their primary care provider is probably the best way to do this. Living a healthy or a heart-healthy lifestyle, that certainly can be helpful, including things like proper exercise, good diet, and smoking cessation. These are all things that certainly go hand in hand with what we're trying to accomplish with prostate cancer care. But otherwise, I think the important thing is that men who are concerned about prostate cancer talk with their primary care provider and consider screening after further discussion. Most men with prostate cancer don't have any symptoms at all, at least not until it progresses to a more advanced and incurable stage. It's very important for men to consider screening for prostate cancer with either a prostate-specific antigen blood test or a prostate exam in order to be able to find these cancers early enough that they can still be considered for curative treatment. I think it's important to note, first of all, that prostate cancer screening, while beneficial for many men, is not right for all men. Most men should consider sitting down with their primary care provider and having a discussion about the pros and cons of prostate cancer screening, typically around age 50 or 55. However, those men who are at higher risk for prostate cancer, African American men, men who may have a family history of prostate cancer, should really start this discussion earlier, maybe around age 40 or 45. I think it's also important to note that the men who benefit the most from prostate cancer screening are men who have at least a minimum life expectancy of about 10 years or greater. And so if you have men who are older or have other competing medical problems, they typically are not going to benefit from screening and typically should not be screened. For most men, it's just important to be aware and educated and informed. And it's about getting in with their primary care provider for regular health checks and just being educated and informed about those potential problems. I think when men ignore those issues or don't see their healthcare provider on a regular basis, certainly they're bound to miss certain diagnoses that otherwise could have saved their life. So I think it's really important for them to be informed, educated, and get regular health checks, and they're likely to avoid problems down the road that otherwise they don't need to encounter.